with time, I think, changed, in my opinion, in regards to advertising. I think you owe to the public the ability to be able to explain to them what you're doing and how that might be different. It's very difficult in the public and a non-medical person's eyes to understand the differences of different types of specialists, for instance, different types of treatment. The day is long gone where the doctor can come in and say to the patient, this is what needs to be done, with no explanation. And to my way of thinking, that day should be done.
I mean, everything is advertisement. We advertise on television, but that's because television is probably the most effective way of getting your message across. We think that spine problems are something that people seek out, different than different types of medical problems. I think that when it's your spine, and there's that, again, that fear of it being the worst thing that you can imagine, you want to seek out what you think is the best. I think that part of the reason that we advertise is maybe there's a little bravado or a little cockiness to it. We feel like we can advertise. We feel like we can show the world what we're doing.
The biggest benefit of advertising would be to help educate the patient. When we talked about the fear of the first encounter, not knowing what other than I do have pain in my back and I don't know what's wrong, if we can educate patients to reduce that fear, to seek help when necessary. I mean, I can't imagine going through life with a bad back and living it to 50% of its capacity without asking or seeking help. So if we can teach them where to turn, where to come to, have their experience be a positive one, and to help them, I mean, that's what it's all about. If advertising helps us do that, then that's okay.